My name is Dr. Monica Prendergast. I'm a professor of drama education at the University of Victoria, and I'm the president of the Confederation of University Faculty Associations of British Columbia, or CUFA BC. CUFA BC is the provincial voice for more than 5,500 university professors, instructors, lecturers, and academic librarians at 5 universities across the province. We work with the faculty associations at Royal Roads University, Simon Fraser University, the University of British Columbia, the University of Northern British Columbia, and the University of Victoria. I would like to acknowledge that the land on which CUFA BC's office resides is on the traditional, ancestral, and unceded territory of the Coast Salish peoples. We acknowledge with respect the diverse histories and cultures of the Squamish, Tsleil-Waututh, Musqueam, and Stolo nations. We are here today to present the winners of the CUFA BC Distinguished Academics Awards. These awards honor the outstanding scholarship and public policy contributions of distinguished academics in British Columbia. Academics whose scholarly activity have made significant contributions to the community beyond the academy. Faculty members in BC's universities engage in outstanding scholarship that shapes new discoveries and deepens our understanding of the world. While much of this work happens beyond the public eye, it has far-reaching impacts on policy, technology, and society. The Distinguished Academics Awards provide a platform to acknowledge the invaluable role of university research in our communities. I am pleased to present the winner of the CUFA BC Early in Career Award to Dr. Laura Schummers. This award recognizes significant contributions to the broader community made by faculty members who are at an early point in their careers. Receiving this award represents the admiration of colleagues from across institutions, disciplines, geographic borders, and beyond. Dr. Schummers joins us to talk about her research.
I'm Dr. Laura Schummers. I'm an assistant professor in the Faculty of Pharmaceutical Sciences at the University of British Columbia.
Can you tell me a little bit about your research interests?
Yeah, so my research aims to improve reproductive population health through evaluating changes to policy and practice affecting reproductive health, access, and outcomes.
So you are recognized for your work to improve reproductive population health through health policy and outcomes research. Tell me about your research assessing BC's policy making prescription contraception free.
Great, thank you. So in April of 2023, British Columbia introduced a landmark policy for in the Canadian health landscape, making all prescription contraception free for provincially insured residents. Now, this policy really marked the end of about a decade of collaboration and partnership between academic researchers, health policymakers, health system leaders, and patient voices, patient advocates. And I was really privileged to join this maybe midway through. So in 2018, when I started my postdoctoral fellowship, I was cross-appointed between the British Columbia Ministry of Health and the Contraception and Abortion Research Team based at the University of British Columbia with mentorship from Dr. Wendy Norman. And so this work was ongoing already with some discussion of what it would take to really implement this policy. And I really enjoyed learning from and being part of conversations to understand what the implications would be within the health system, within the policy landscape, and how to sort of align the priorities to make this change happen. So over the course of several years, we engaged in meetings and discussions about what would be the impact, what is the need for this? Why are we considering this policy? And how might this policy change reproductive health outcomes and outcomes beyond health? So we were considering, should all methods become free or only the most effective methods? Does it make the most sense to look across the whole population or only subgroups at the highest risk of unintended pregnancy. And so this was something that I joined those discussions, and it was really in the wake of some health economic modeling led by Dr. Sterling Bryan, where in addition to these health outcomes, we know this policy uniquely also saves money. So for the health system perspective, we know that over time, we anticipate saving money by making prescription contraception free. So with that backdrop, as I started my faculty role in 2022, I jumped right into this and partnered with the staff within the Ministry of Health to design an evaluation policy. We knew this policy was coming. It was in the ministerial mandate letters for the BC Ministry of Health starting in 2020, again in 2021. We were waiting for the sort of precipice to push us over the edge to bring the policy into real life. So we had to think through, how can we evaluate, is this policy working? So the goal is to improve access and uptake of the most effective methods of contraception. How do we measure them? What does that mean? And access in particular is a complex domain to study. And then we need to think through, what are the implications? What do we think will be affected by improved access to contraception? So in really a close partnership, we designed a dashboard and an evaluation framework. And then bringing the academic lens in, I prepared a grant with a national team of clinicians and health policymakers and researchers from a number of provinces to implement this as an academic question. So we sought to use what are called quasi-experimental methods to really estimate the effect of this policy on first contraception use, then on contraception access, and then measure what happens to pregnancies. Do we see a decrease in pregnancy rates and abortion rates? And then in the long term, what happens to health system costs? So do we save money as a health system when we provide access to contraception? So we know that 40% of pregnancies in Canada are unintended. This includes pregnancies that were mistimed or pregnancies to individuals who never actually wanted to have a pregnancy. And this, we know that unintended pregnancies are associated with poor health outcomes for both the pregnant individual and their offspring. And then even beyond that, unintended pregnancies are associated with less educational and economic attainment for the pregnant individual, and that can then lead to intergenerational poverty. So there are really widespread societal effects of continued and persistent high rates of unintended pregnancy. And providing better access to prescription contraception and family planning methods is one of the most important policy levers that a health system can use to improve those measures.
Your nominators described your critical role in evaluating the impact of Canada's regulatory and policy approach to medication abortion during your Health System Impact Fellowship between the BC Ministry of Health and UBC. Can you tell me about this work?
Yes. So in 2017, Canada introduced the medication abortion drug mifepristone. This medication had been available for decades in other countries, but under a very different policy framework and regulatory framework that really restricted access to this medication to purpose-specific abortion clinics. In Canada, we've had a long-standing challenge with inadequate, inaccessible abortion services located mostly in the southernmost urban centers. This meant that before 2017, most individuals who needed abortion care needed to travel long distances, maybe getting care for their other children, taking time off of work, needing to logistically sort out how to access abortion care. So when mifepristone was introduced in Canada, Health Canada took a very different regulatory approach. And over the course of the year 2017, they removed all of these kinds of specific limits to mifepristone and made this medication available like any other prescription. This meant that by province, it varied a little bit province to province, but by 2018, the medication was available as a normal prescription where any physician or nurse practitioner could prescribe, any pharmacist could dispense, and patients bring the pills home to take when or if they choose. So there were some questions about this globally. This is an unprecedented approach. So what would happen? Would this be safe? Would we see a huge rise in abortion rates? what would happen? So our team used population-based data to evaluate the effect of this policy change on abortion rates and on abortion safety, adverse events and complications. And we published this in the really globally leading medical journal, the New England Journal of Medicine, in 2021. And what we found is that access improved. We saw very slight increases in abortion rates, which we attributed to showing unmet need for abortion care before this policy change, but not a jump, just a very slight increase. And we saw that abortion safety was preserved. Nothing changed. Complications remained stable, severe adverse events remained stable, and subsequently, this led to some changes in the US with the FDA removing some of their specific restrictions on this medication, and led to the adoption of a similar framework in Australia. So this work, we hope, will really continue to pave the way for improved access to abortion care as part of a suite of accessible family planning services.
In thinking about your career to date, how does your work support equity, diversity, and inclusion in health access? And what about access in post-secondary education?
So I think from the research standpoint, because of the really broad effects of unintended pregnancy societally, improving access to family planning services is an essential component of reproductive justice. So reproductive justice is really about equipping individuals with access to reproductive services so that they can control their own reproduction. They can decide when or if to become pregnant. So from that perspective, reproductive justice and equity, diversity, and inclusion are core principles of the research program that I lead and are core outcomes that I hope to impact over the course of my career. Within my team and higher education, we have a mostly female team. We really try to invite scholars from underrepresented communities to join our team and to learn how to bring their lived experience, why that's actually relevant and will improve the impact of their research.
Great, thank you. Your nominators describe you as bringing a patient-oriented approach to your research program and possessing a keen ability to work seamlessly across shared disciplines and sectors. Why is it important to you to engage in research that's collaborative and in the public interest?
Yeah, so I think so often academic output can just remain in the ivory tower. I mean, we publish these academic papers and they sit on a library shelf and sometimes are read by the niche experts in our field. And that may be useful for moving science forward and building an evidence base, but it doesn't always really impact the people who pay for research through our tax dollars and who need an improved evidence base to support their healthcare and to support their public policies. So to me, bringing patients into my research program, partnering directly with policymakers, clinicians, health system leaders that have expertise that I don't, is essential to make sure that I'm asking the right question. Is this important to you? Is there a better way to pose this question so that the results will be more meaningful from your perspective? It needs to start from the beginning of a research project and continue throughout the implementation and the interpretation of findings so that I don't just have my research sit on a shelf, but it can actually be used out in the world to improve reproductive population health. Because if we're not putting these findings in the hands of clinicians, leaders, and patients, it's not doing its job.
How does your work advance the calls to action in the 2015 Truth and Reconciliation Commission report?
That's a really important question and something that is mostly focused in my area on both health and education calls to action. So reproductive justice is, again, an essential part of achieving gender equity and improving equity across all domains. So equity-deserving populations, especially those that have been affected by things like the residential school system and colonization and racialization. I'm from the U.S., where we have other elements of racialization that are still very important to consider. It's really something that our research has to improve. So by enabling populations with the tools that they need to determine when they become pregnant, that's one way that we can help people to finish school, to achieve their educational goals, to have socioeconomic success intergenerationally. So this is something that through a reproductive justice lens, we need to make family planning services available to all. In Canada, we've had a long history of inaccessible services for people living far from cities, and we know that this disproportionately affects Indigenous populations here. So this is one way that in my own research area, we can improve equity and toward achieving the calls to action in the Truth and Reconciliation report.
Great, thank you. We focus mainly on your research, but you're also a teacher and mentor to the next generation of scholars. In your teaching, what is the most important message you want your students to take away from your classes?
So right now, the main teaching that I do is to pharmacy students, and I'm teaching about how to read research. So this is, to me, getting excited about epidemiologic methods to clinical trainees means that they will be better able to use evidence as it comes out that's relevant to their clinical practice. So to me, equipping clinical learners with the ability to read health research will ensure that their practice is more evidence-based when they're out in the world providing health services. And that's the lens that is most valuable to me.
Is there anything else you would like to say to the nominators or to the selection committee?
Well, of course, thank you. First, thank you for this award. I'm just so honored to receive the award. In addition, I'm so delighted to see reproductive health and contraception and abortion access highlighted right now, where in the global political climate that we're in the middle of, it's essential for Canada to remain a leader. And having an award that is focused on contraception and on abortion access in the Canadian context means that our institutions, our government partners, we still value reproductive health and justice, even when other settings might be eroding reproductive rights and access. In Canada, to me, receiving this award now is meaningful because this is telling us that we need to continue our efforts to remain global leaders in reproductive health and access here in Canada.
So thank you for joining me today to talk about your work. I want to congratulate you again on being awarded the 2025 CUFA BC Early and Career Award as part of our annual Distinguished Academics Award series. I look forward to following your successes at the University of British Columbia.
Thank you.